management of the University of Cape Coast met with the Central Regional Director for Health, and we discussed the global issue going round. And because the University of Cape Coast has a very large population, we felt there was a need for us to take some proactive actions so that we can safeguard the safety, health, safety, and security of the community. So, in the discussions with the Central Regional Director of Health, we came to the conclusion that we need to take some major decisions. And those decisions were the ones that we relate to management at all levels, that provost, deans, heads of department, directors, coordinators, so that they can go ahead and tell colleagues as we start education programs for our staff and students and also the communities around us. I'll just outline some of the things that decisions that we took. First of all, the university is an international institution, so we have international partners visiting us every now and then. So one of the decisions we have taken is that we are suspending all international conferences that we are supposed to host until further notice. And until further notice means until um, the Ministry of Health advises us that it is safe for us to host travelers who are coming from elsewhere. So we are suspending all international conferences. We are also suspending all international travels for our own staff. There are staff who are supposed to attend conferences elsewhere, seminars, workshops. For some of them, we have even issued tickets. We have booked accommodation, but we have to suspend them. So we have informed staff that they cannot go. We have also, there are a few who are already out. So we have communicated to them that when they come, they should first of all inform us, the university, and then they should also self quarantine. They need to inform us so that our health services can advise them on what they can do because they are traveling internationally, flying with other people. They themselves do not know what they will bring. So we need to help them so that they can also help the whole institution. And then also we have
So for how many days should they self quarantine? Is it 14 days or 5 days?
yes, we told them that they should self quarantine for at least 5 days, and because they will inform the Directorate of Health Services, they will monitor them and then let them know if they are safe to come to the offices. Because we have been informed that within 5 days you will see symptoms. If they may be mild, but you will still see some symptoms. So we have advised them that at least for 5 days, but by the 5 days, our health services would know if they are free to come to the offices while they are still monitored for the 14 days incubation period. And we have also stepped up our education on the ATL FM, education for the whole community and those in the ATL FM catchment area. We are working with the Central Regional Directorate of Health Services to run programs for the communities, as we did with the cholera outbreak some years ago. So we are working on that too. And if you go around our campus, you will see that we have posted notices around educating people on the virus and what they should do. What you say you see around would be the use of sanitizers. Yes, we've asked all heads of department and program organizers to make sure that we have them around. We are also management is going to put dispensers at vantage points so that people can use around. It's not only those who are going to programs or going to an office. Um, we also educate people to wash their hands often and to observe people if they see that others have the symptoms or anything that they think is strange. They should inform. There's a hotline to call. So this education is going on. So I think right now these are the steps that we have taken. We do not have any case on campus, but we are being proactive. And we were very, very um, happy that after we had taken these decisions, the following day, the President of the Republic came to say that he has suspended all travels for public servants.
So
And
your measures were before the president even addressed the nation.
yes, because we had our meeting 2 days ago and we sent circulars to all um, provost deans, heads of department to come to an emergency meeting the following morning. And it was the following morning that we heard the president say that it's suspended. So it's in line with what is going on. And we have a campus that has about 20,000 students and over 1,000 lecturers, about 4,000 staff, and it is our responsibility to provide the community with these decisions so that we do not have any problem on our hands.
How should students here finally? How should students here take these measures you've given them? Are you assuring them that everything is under control? And those who might even be traveling to neighboring countries, we know that the countries surrounding us, they've all reported or cases have been confirmed there.
It is part of our education program. You know, we have students from neighboring countries who are here as international students. The Center for International Education is handling that. We are monitoring their movements to make sure that they do not travel home within this period. If there's a need for us to support them for whatever they were going to do, the university is ready to support them because we want to contain ourselves here. We don't want to expose ourselves and then come back and find ways of uh, remedying the situation. We're taking preventive measures. So we are educating the international students as well so that they will know what to do. And the other thing is that when they we had a meeting, management had a meeting with the director for health services, the central region director. He informed us that the Ministry of Health, through the regional directories, they have holding places that if there are suspected cases, they would be sent to, and then we would inform them and all that. Our university health services is working with them, and so we know what is going on. We have been informed by our health services that the Central Regional Directorate has given them some PPEs, there's the protective gears. Although there are not many, at least for start, they have something. So we are working with the health services, the Ministry of Health, to make sure that we keep our communities safe. And as I want to emphasize that it is not only students and staff of the university, but also the outlying communities, because a lot of our students live in the outlying communities. So we're taking the education to them too. Um, we said this, we decided on this 2 days ago. We informed our communities yesterday. We are working so that by next week, all these series of education programs would be going on. And we also using our school for nursing, our Department of Health and Allied Sciences, and the School for Medical Sciences to make sure that they are educated and not given information that is not factual. Because in doing all this, we don't also want to cause panic. Because when we cause panic, then we would have worsened the situation. We don't want anybody to be panicky. We don't want anybody to think that there's a case here. We don't have any case here. We're just being cautious.